everyone, this is Isabella. I'm a pharmacist. Today I'm going to share you a method that can stop flu, COVID, and strep throat right away. I did it on myself, and I believe it worked better than a prescription medications. So I had COVID before. I took Paxlovid. 2 days later, I just feel like it getting worse. I cannot bear anymore, and I stopped. I didn't finish the Paxlovid myself. I also took the Tamiflu, and doesn't help much as well. So this method come from a patient came to the pharmacy and asked me she about to have the flu. What can she do to stop it from progressing worse? So we all know from the book, the virus when it comes to our body is live about 7 days. We can go to the doctor to get the prescriptions and can shorten 2 days of symptoms, which means we still will be miserable for 5 days. Besides that, we may experience side effects from the medication as well, like nausea and vomiting, besides congestion, runny nose, cough from the virus. However, with this method that I discovered, I used it on myself twice, and it worked wonder. And it worked right away. Like the next day, you feel better. I feel better. So I like to share it with everybody so we can help ourselves from getting worse. There are people died from flu and COVID. Also, it's spread very easy. Especially if we have a baby, we definitely don't want spread to our baby because baby cannot take any medications. And this method will stop the flu, so we will not experience any miserable days, and also it will stop from spreading, so we will protect our babies. So to me it worth millions of dollars of discoveries. It's very simple, very easy. It's something that we use every day. First of all is the Listerine mouthwash, and second is a soap solutions. You just need soap dissolved in water to make a soap solution. So first of all, with Listerine, we pour into a cup, gargle in our throat for as long as we can to kill all of the germs in the throat, any virus or bacteria right here on your throat. Gargle as long as you can, spit out. Then you pour to another cup, squeeze in your mouth as long as you can, and then spit out. You can alternate that with a salt solution. I say when you just start feeling it, you do it right away. And between 30 minutes to 1 hour, you alternate with salt solutions. Do the same thing, gargle. So with salt solution, it's easier to gargle than the Listerine mouthwash. So with salt solution, I recommend you gargle 1 to 2 minutes. Then spit out, and then through your mouth, squeeze through your mouth as long as you can, 1 to 2 minutes, then spit out. With salt solution, I do it a couple of times until the cup finished empty. But with the Listerine, do once because it's very hard on the body. So after you squeeze it in your mouth, you can use water to rinse your mouth. So after Listerine solution, you can rinse your mouth, spit out, and after salt solution, rinse your mouth, spit out. However, you leave your throat alone. Do not rinse your throat. Leave it there so that the solution can kill any bacteria or viruses on your throat. You do that multiple times at first, like 3 times of each solution. Do it aggressively so that the virus or bacteria doesn't have a chance to reproduce. Because when our body feel the symptom, which means they already a good amount in our body, and what I think is they live in the nose and throat, because think about it, when we get diagnosis, they find the virus on here to test if we're positive for the flu or the COVID or not, right? So they will live right here in the nose. And also we transmit the disease through our spit. So we talk and we it go out and touch other people's mouth or nose, which means they live in our mouth. So we need to clean it real good in our mouth, and especially the throat, because I think it's the most severe in the throat. They leave it easily right here, and then it can go down to the lung where it gets worse. The worst when it go down to your lung. So make sure you clean real good the first couple hours. The nose right here, you can clean or not, up to you, but the best you is clean it. So if you can go to the drugstore, get a saline solution for nose and rinse your nose. If not, you can just use the soap and alternate with the Listerine solutions. So I did that aggressively for the first couple hours. So I still feel a little sore on that day because it already caused the damage in our body. So the virus already eating some things, and we refilled it. But however, the next day, I don't have any symptoms anymore. I don't have any more sore throat. I have a very weak throat. I had it before multiple times, and as soon as I have sore throat, I know it's gonna get worse. It never stops. It's gonna get worse, and then other symptoms start, like runny nose, congestion, cough, and it all go like that. It never stops after the sore throat. However, after I did this, my sore throat go away the next day. At night, I feel a little bit congestion because I did not rinse my nose with a saline solution. However, it's not that significant compared to when I did not use the solution. So at night, I can either breathe through mouth, or I can use a Sudafed to treat congestion. Very simple as that. The disease already stopped right away the next day. If you have a congestion, or you feel like because the nose, I did not rinse, so some of them can drip down to the lung and cause a little bit congestion in the lung like normal, but it's very mild, very, very mild. And it causes a little bit of cough. We can take this. So I do it twice. The first time I did not need to take any medication, it's go away. The second time, because the whole family got sick, so my parents got sick first, and then I start feeling the symptoms, and I treat with the solution, it's go away. But I feel like I have a post-nasal drip. I have a little cough, which means I have some mucus in my lung. So, and also this is something I recommend whenever you are really sick. You're gonna take this. First of all, is the guanfacine 600 milligram. So this is the generic of Mucinex. The guanfacine will break down any mucus in our lung. So when we use sick, because it will cause congestion in our lung. So I would suggest you take 600 milligram twice a day. If you are very large persons, you can take the maximum dose with 1800 milligram, but I would start with 600 milligram. And then they have the Mucinex DM, which contain the dextromethorphan. It's a cough suppression. So do not take the dextromethorphan alone because it will suppress the mucus in our lungs, and we don't want to do that. We either let it cough out, or you can suppress it if you take the guanfacine already. So we recommend take in combination. The guanfacine will break down the mucus in our lung, and the dextromethorphan will suppress the cough. Good. The next one would be the Sudafed, or pseudoephedrine is the ingredient of Sudafed. They have another Sudafed over the counter. It's called Sudafed PE. That product isn't very effective. I recommend you go to the pharmacy, present an ID to the pharmacist, and ask for Sudafed. And that one will have congestion very good. And at night, if you lay down, you feel like the cough uncontrollable. The Sudafed condition not only help you suppress, help with the congestion, it also suppress the cough. So However, if we take too much, because I don't think it's good to take like around the clock. I only take at night when I feel it's the worst, because I give my body the chance to fight the virus. Our body produce all the mucus to fight the virus. It does cause uncomfortable to us. That's why we take it, because it's unbearable. When unbearable, I'll take it to suppress it, but I do not suppress it all the time. Like when I go to work, I suppress at work so that I can work easy. But when at night, I just let it go. I just let out my body react to the virus and kill the virus. So usually the cough and the congestion was at night. So even though the Sudafed ingredient will cause, it's a stimulant, so it is said that it will cause insomnia, but the congestion itself is worse than insomnia, so I take it anyway. I took it anyway, and I can sleep through the night just fine with that. So there will be 3 different strengths over the counter. The 30 milligram, I would use that first if that works for you. And then the 12 hours and 24 hours, I would either use the 30 milligram or the 12 hour first if you haven't used it before. And then the last ingredient is loratadine, or any first generation antihistamine over the counter. Loratadine is generic for Claritin. It's an antihistamine. It will have with Ribindol, things like that. That one and Sudafed, I suggest only take once a day. Regarding the dose, it's on the label, it say every 4 to 6 hours or every 12 hours, because I give my body the chance to fight the virus and prevents any intolerance later. Our body may not work anymore with the highest dose. So that is the 4 ingredients that I recommend you if you feel really sick already and you need to take something for you to feel better. And also you can take Tylenol, Advil for pain or fever. However, if you apply my method immediately, it will stop the virus from reproduce. So the amount in the body is too low that it doesn't cause fever or pain. I feel wonderful the next day already with the method I just shared. And I hope it works for you as well. So when I was little, I have strep throat all the time, like every year, include in college. I have strep throat every year. Strep throat is another, is a bacteria that causes sore throat. So there are 2 kinds, either virus or bacteria. The virus causes sore throat is like from the flu or COVID, we already know. And the bacteria is a different kind. So bacteria will not die in our body. It will continue to grow if we don't take antibiotic. So I took antibiotic, and it's gone, but it keep come back every year. So that one time in college, I treat myself with contraceptive. I bought a contraceptive spray on a Q-tip and clean my throat. So whenever you open your mouth, you see on this 2 sides right here on throat, if it's white, you see the white matter, it's the bacteria infection and that's not virus. So I clean that white matter off my throat, and make sure you just use one Q-tip one side and then use a different Q-tip on the other side. You don't reinfect yourself. Clean it real good, and then you gargle with salt water, spit out at 1 to 2 minutes, and then the mouth 1 to 2 minutes. Alternate with mouthwash or as well. I use that, and then I feel pain. Then I took Advil and vitamin C. Then the sore throat go away in 2 days, and I never had the sore throat again after I use this method. So I want to share it with you. So normally you will have to go to the doctor to get antibiotic if you have sore throat. But I did that on myself. I never have sore throat again. I have very weak throat, and I've been having it my whole life. But after I use this method, I don't have it anymore. And also, when you sick, my body is very sensitive. I feel it right away that if I drink or eat something that's not fresh, I feel sick again. So when you're sick, I recommend you drink a new bottle. Like, do not drink the water over 24 hours. Or a cup that you drink, you need to wash it every day. And when you're sick, don't drink old water that already open over 24 hours. Old food, you need to eat fresh food. I'm guarantee, well, from my experience, get better right away. So that's something that you can do for your body when you're sick, to support your immune system. And so to prevent from getting sick, I recommend every day after you go out, you need to brush your teeth real good to prevent germ live in your teeth. And then you use a mouthwash, gargle, and then squeeze in your mouth, spit out. That will help from prevent getting the disease. But once you get sick, you need to deal with really aggressive at the beginning, the first couple hours, to stop the virus from reproducing in your body and kill it and take it out of our body right away. I feel very comfortable to talk to my baby after I clean my mouth for the first 30 minutes, because I believe there's a very little amount of the virus in my mouth at that time. So it really helps when you have a little baby living with you and you don't want to transmit the disease to the baby. Do it aggressively the first couple hours to make sure the virus die, or not go reproducing. And that's it. If you feel like it worked for you, please let me know, and have a wonderful day.